Hi, my name is John Barbadian. I was fortunate enough to meet Dr. Todd Peters during the year 2015. Prior to that, I had suffered almost for 30 years with very serious back pain. But I've worked in the hospital industry for over 30 years. And during that time, I tried almost every type of procedure to work on relieving my pain. But I never considered having back surgery. Working in a hospital gave me a great deal of insight as it relates to having back surgery. And maybe the 30 years also gave me the insight into maybe that 30 years of waiting helped me to get the idea that good things were about to happen in healthcare as it relates to back surgery. But I never considered having back surgery because I didn't want to have, I never saw anybody really have any improvement in their back surgeries that they had done. But in 2015, I met a wonderful doctor, and his name was Dr. Todd Peters. And Dr. Peters talked about doing a minimally invasive surgery on my back. And he talked about doing some things on my back that no one else had ever talked about. And frankly, he talked about some things that there were on my back, and on my nerves in my back, that nobody had ever noticed in 30 years. And that was, I had two cysts that were pushing against my nerves on my back. And then he said, John, you're not going to have a surgery that's going to be something like a 5 or 6 inch incision on your back. It's going to be something like a 1.5 inch incision. And I said, what? And I said, well, the more and more I talked to Dr. Peters, and again, I'm putting in this in the perspective of someone who's worked in the business, I became more and more convinced that this was the best opportunity for me to improve my condition. I had terrible pain. I had so many epidurals, so many pain pills. My life was not really good at that point. And I said to myself, this is something I'm going to try, because this is something I think that will really work for me, and it's minimally invasive. If it wasn't minimally invasive, I wasn't going to do it, because I knew what the other types of surgery were, and I knew they didn't work. And I thought to myself, Dr. Peters is the man to work on me. And again, he found out things that were related to my back that no one else did. So I felt that my chances of coming out of this surgery were good. I had the surgery on February 18th, 2015, and I have to tell you, right after my surgery, I didn't feel any pain going down my leg. People that I knew said, John, you move better. You can move around in your chair, you stand up differently, you're a different person. And I feel like I'm one of Dr. Peters' success stories. I'm very fortunate to have met Dr. Peters, and I have to tell you from my heart, and I'm someone that can tell you that if you're interested in having surgery, you need to at least have a conversation with Dr. Peters, because I think that once you have a talk with him, and see what kind of individual he is and what kind of surgeon he is. He's going to help you, and he's going to help you relieve that pain in your back and help you become a better and more whole person again, and bring back life to you and your family. You'll see the difference. Thank you.